I'm David Lee. I'm Associate Professor of Medicine at Stanford University, and I'm Director of the Cardiac Cath Lab. A percutaneous coronary intervention, or PCI, is a description of a procedure that we do in the cath lab. And what it is that if you have a blockage in your coronary artery, the arteries that feed blood to your heart, oftentimes we'll put a balloon in there and do what's called balloon angioplasty, or place something called a coronary stent. That's to fix the narrowing, relieve the narrowing that's there. CIN, or Contrast Induced Nephropathy, is a description of a complication that can sometimes happen in the cath lab when we do these types of procedures. We do give contrast dye. It's important for us to have that so that we can actually see the narrowing that we're trying to fix. The main issue actually with contrast-induced nephropathy is that if we give too much, or if you're already sensitized to the contrast dye, then you can get into trouble because the contrast dye has to be cleared by the kidney. And sometimes the kidney can't handle that dye load. The kidney can become damaged by the X-ray dye. There was a recent study in JACC, or the Journal of the American College of Cardiology. Tom Tsai actually led the study. 30%, or 1/3 of the patients, have abnormal kidney function going in. And we know from the study that those patients who have abnormal kidney function going into a procedure like this are at higher risk of CIN. So they generally are the patients who are driving this relatively high number of events, including CIN, but also then the bleeding, the death, the heart attack, all those other complications down the line. So it's actually a relatively large population within patients who are undergoing PCI, that up to 1/3 of them may already be at risk for having CIN. Generally, the things associated with CIN are not just the kidney problem. The other things that are associated with it, though, are things like bleeding and also having another heart attack. If you looked at the patients who had generally normal kidney function after the procedure, they did very well. It was a very low death rate, well under 1%. However, if you started to develop this kidney problem with this CIN, the death rate went way up. And if you had any stage of kidney problems afterwards, the death rate was close to 10%. We do everything we can, and despite that, a relatively high number of patients still experience CIN. Osprey is obviously interested in prevention of contrast-induced nephropathy. The work that they're doing is important. I think that the goal here is also not only for the patients themselves, but also to help hospitals potentially manage this as well for the future.